actually, just very quickly, do you happen to have a pair of sunglasses on you? Sorry, a pair of sunglasses. Yeah. Well, not only do they look cool, but we're going to be shining quite a few lights into your eyes today, and so your pupils will be dilated by the time that you leave, and it might make you a little bit more sensitive to bright lights, or you might experience a little bit of blurred vision, and often if you wear shades after an optometrist appointment, then it can help to alleviate some of that. It's okay if you don't, we can lend you a pair anyway. Okay. Yeah, you want to look like a celebrity anyway when you leave. You already are a celebrity. Okay. So just very quickly, are you having any eye problems now that you're aware of? Any discomfort or blurred vision, anything like that? Okay. And have you had eye problems in the past? Yeah, difficulty in seeing, or headaches, or migraines, or just eye pain or strain in general. It's okay if you can't remember. Okay. Do you wear glasses or contacts? Yeah. Would you? Yeah, okay. And are there any general health issues or problems that you've had within the last year that you can recall? Yeah, not colds and stuff, just anything serious. Okay. Yeah, it's more of a process of elimination, to be honest, working out what might be related to what might be causing that. I suppose a diagnostic approach, if you like. Oops. Okay, and what current medications are you on? Prescribed? Sure. Do you have any known allergies to any medications or any food or other substances at all? Yeah, like latex or anything like that? Okay. And have you ever, in your history, had eye surgery at all? Alright. As far as you're aware, or as well as you know, does anyone in your family have eye problems such as macular degeneration or glaucoma or retinal detachments or anything like that? It's alright if you can't remember. Apologies for the plain. Yeah, sorry. Has anyone had any, eye problems or conditions in your family? I apologise for the laughter outside as well. Okay. And finally, do you or anyone in your family have a history of diabetes or high blood pressure, CHD, or any health problems that sort of holistically affect the body, so they affect the whole thing? Yeah. Yeah, blood illness would count, like haemophilia or anemia. Okay. All right. So that's all the questions done. How was that? Yeah, thank you for your patience. We have to go through the rigmarole every time just to make sure, because people's circumstances change, and more often than not, they don't let us know, or they don't update their status or anything like that. I mean, I know you're very good, but some people don't. That's right. So we'll be doing a standard eye examination today. It's nothing you haven't done before, nothing that you haven't experienced or probably got very used to. That being said, before we begin, I just want to remind you that as always, you're in complete control, okay? You shouldn't feel any major discomfort, although some of the bits might be a bit weird. However, if you do at any point experience discomfort or pain, let me know. I'll make a note of it, and we can either skip that part, come back to it later, or just use that information to help us get the best possible result for you, okay? But yes, certainly, you're in complete control. And also, I think it's very important, I want you to be able to relax during this examination. A lot of the time, I'll be asking you to open your eye. But if you feel like closing your eyes, that's fine too. Okay? Would you like me to just tell you the different tests that we're going to be doing? Just so you know. No surprises, then you can just relax. Sure. So we'll be doing an eye muscle test first, which is just following the light. And it's a bright light, but not uncomfortable. Then we're doing visual acuity, which is the eye chart behind me. Yeah, like I said, nothing you haven't done before. Okay? Then we'll do a little refraction assessment, and that's just testing different lenses and things like that to see if we can improve the acuity of your vision. That'll be followed by a visual field test, which is what we call confrontation, and also manual testing. So that'll just be covering eyes and checking them individually. Then I'll perform a close-up retinal examination, where I take a look right in your eye, and that's probably the second most uncomfortable bit, but also possibly the most relaxing as well. And finally, we'll just do a quick glaucoma or glaucoma screening, and that's where I'll just be puffing a little bit of air right into your eye. That's the most uncomfortable it will get, but again, by that point, hopefully, you'll be nice and relaxed. I do just want to say again that, of course, you can stop the entire examination at any point you want. We can reschedule, or we can start it a bit later today if you prefer. If you don't like me, or you find my bedside manner far too familiar or weird, then there are loads of exceptionally talented optometrists, if I can say it, out there who I'm more than happy to refer you to. Yeah. Ultimately, your comfort, your confidence, and your safety are what's important. Okay. That was a significantly larger disclaimer than I thought I was going to make at the start, so I want to thank you for your patience with that. But if you're ready, then I think we can begin. Is that okay? Thank you. So, first up, can you remember? That's right. So it's an eye muscle test. This is just checking the musculo-dexterity of your eyes, your ability to move them, any fatigue you might experience, as well as just speed of movement as well. It's important that if at any point during this part of the examination you feel discomfort, you let me know, and you let me know where and when it occurred. Right? Excuse me, a bit hoarse. This is the pen light that we'll be using today. I'm going to turn it on, and I'm just going to shine it briefly behind my hand, like this, and then reveal it, okay? There we go. How's that? So that's as bright as the light goes. Is that okay for you? Is that comfortable? Alright, brilliant. So, without further ado, let's try to help you. Please relax. And at this stage, if you can just keep your head. And still, it's possible. That would be great. Just move your eyes. Here comes the light. Up from your left. Now what I want you to do is follow it with your eyes as I move it from side to side. Okay? So to your right and to your left. Then up. Then down. Up. Down. That's it. Keep following it. Just here. Okay. Up. Down. Left. Right. And away. And in. And away. And in. Keep following it. That's it. And back. And forward. Left. Right. Up. Up. And random. Okay. Yeah, I'm doing a sort of infinity. So I used to call it a dead 8 when I was young. That's me. That's it. Keep following it. Thank you. Any discomfort so far? Okay, good. And back. And forward. And back. And forward. And back. And forward. Right. Yep, that's it. Yeah, we keep it quite dark in the room so that the light is more visible. All right. Okay. So any discomfort? All right. Same again, but this time no light. Just the tip of my finger, okay? So focus on my finger here. And so try to ignore the extraneous noises outside. They're doing some work nearby. And just follow this finger with your eyes. If you can, don't move your head. Keep still. Relax. And follow the finger. Okay? Is this easier or more difficult than the light? Alright. Thank you. Alright. So, the next bit, I'm going to ask you to look at the chart just behind me, and what we're going to do is read out as best you can each line in succession, okay? So I'm just going to move to your left, if that's alright, get a little bit close and let you see what we're looking at. Alright. Okay. So, if you just look ahead, please, you can see, well, you can see the poster, at least, alright? What I'd like you to do, if you can, is read the top line up there, okay? That's it. Now please, if you just read the next line down. Alright? And if you can, the line after that. Perfect. Can you try the next one? It's okay. If you, yeah. Okay, and the next one. Okay. Right. No, you did great. Thank you very much. So what I'm going to do now, we're going to do the same thing, but I'm going to cover one of your eyes. Okay? We'll start by covering your left. Alright? Is that comfortable? Okay. So read the top line for me. Yep, just up there. Okay, well done. Now read the next one. Okay. The next one. Alright. And can you read the next one? Alright. Try the next. Okay. Alright, I'm just going to walk behind you and cover your right eye. So, excuse me for a moment. Thank you. And here we go. So I'm just going to cover your right eye there like that. Now, can you read the top line for me, please? Thank you. And the next one. Alright. Okay, and the next one. Okay, yeah. And try the next one if you can. Alright. Yeah, that's great, thank you. Okay. Apologies for all that moving behind you business. I hope that was okay. So now we just had to take a look at that, the Acuity, which is the eye chart. What we're going to do now is do the same thing pretty much, but we're going to do a refraction assessment. So I have here these extremely stylish vintage refraction spectacles. I mean, yeah, I wouldn't blame you if you just wanted to take these out of the shop. That's your prescription now. I think they look really cool, actually. But we can put different lenses into this and also get the correct size of your facial structure should we need to prescribe you a pair of spectacles today. Alright, so first of all, I'm going to pop these on you. So I'm just going to roll in on my chair a little bit closer. Alright, is that okay? Alright, so are you sitting comfortably? Here they come. Okay, perfect. How is that? Sorry, I'm just making adjustments. So this bit's on your bridge. Is that okay? Yeah, it should rest quite softly. Not too tight. Okay. Alright. Thank you. Now, I'm going to go to each side again, as I just did, okay? And we're going to try some lenses, alright? And see if they help your vision, impair it, and if there's anything we can do to just get you seeing as comfortably as possible. So I'm going to get up again. I'm going to move to your left-hand side. I'm going to try that first. Alright? Okay, here we go. Okay. More lenses. Alright. Alright. So, how are you feeling? Well, we haven't put any lenses in yet, so that's probably why there's absolutely no difference. Let's go ahead and try one. Okay, so yes, on the left eye first. Let's try this. Okay, how's that? Better or worse? All right. What about that? Better or worse? That sounds a bit like marriage, doesn't it? For better or worse, but. Alright. Next one. Alright. Better or worse? Okay. Next one. Better or worse? Sure. Alright. Next one. Better or worse? Okay. Next one. Better or worse? Okay, thank you. And next one. Better or worse? Alright. Thank you. You're doing great. Yeah, thank you. Alright, next one. Better or worse? Mm-hmm. Okay. Yeah, just... Okay. Next one. Better or worse? Okay. Alright. And the next one. Better or worse? Okay. Thank you. Last one. This side. Better or worse? Okay. And any discomfort at all, or anything like that? No. Alright, I'm going to scooch behind you. Excuse me. Alright, now, same again. Yeah, exactly the same, but the other eye. So you just tell me better or worse, right? So let's go. So, that's this one, better or worse? Okay, thank you. And this one, better or worse? Alright. And what about this one, better or worse? Okie dokie. Thank you. And this one, better or worse? Alright. Yeah, just over here. Thank you. Okay, this one, better or worse? Okay. This one? Alright. Okay, a couple more. Let's just do a couple more. So this one, this is better or worse? Brilliant, thank you. And finally this one, better or worse? Okay. Thank you. Let me come back around. Alright. How is that? Yeah, let me get these off you. I still think they're really cool. Yeah, we do have a modern refractor, but what can I say? I like the classics. Okay. Oops. So I think we've got some clear winners and some clear losers as well there. There you go. Right. And the glasses. Excuse me. Just change this glove. The settings that they were on, that was alright for you. They weren't too tight. They were comfortable. Very good. Now I have to do the slightly clammy hand dance into a new glove because I scratched my foot. There, that bit. Alright, so now we've got the confrontation test. Alright, so I'm going to stay in a little bit close, if that's okay. And I think that's as good as that's going to get. Let's do... Well, we'll do confrontation and manual testing. Okay? So I've got my digits here. And I'm going to leave them here, like this. What I want you to do is, as I move them, tell me when they leave your field of vision. Okay? And of course also tell me if you feel any discomfort at all. Here we go. Okay. Yeah, if you keep your eye on a fixed point, unfortunately my face, but prove my nose, okay? Let's try again. Okay, thank you. Again. Thank you. Again. Perfect. Again. Let's do it with the pen. Just really quick. Like that. Yeah, just focus on that. Straight ahead. Don't move your gaze. And tell me when it goes out. Okay. And again. Okay. Let's turn the light on briefly. Same again. Okay. Same again. Now, let me know when you see the light enter your peripheral vision. Alright? Pardon me? Okay. On the other side, we. And again. Okay. Again. Thank you. Okay. Alright, brilliant. Thank you. Do me a favour, if you'd be so kind. Could you cover your left eye for me? Yeah, I'll just quickly do the same thing. Mm-hmm. Okay. Alright. Thank you. Cover your right eye for me, please. Yeah, this one. That one. Okay. Yep, uncover your eye, relax. Just very quickly, this one more time. Okay, and back in. Thank you. I didn't think the confrontational manual would be too challenging for you, so, right. Are you ready? I'm going to get in even closer. Can you believe it? And I'm going to take a very close-up look at your eye. I'm going to ask you to not blink, look up and all that sort of stuff, but please relax. And if you feel discomfort or any pain at all, just let me know. Okay. So it's going to be quite bright. Alright, let's take a look. Alright. Yeah, can you look up for me, please? Alright. That's it. Beautiful, thank you. Just look down for me. Look to your left for me, please. Just look to your right. Sorry, I'm just going to steady my hand. Yeah, is that okay on your shoulder? Thank you. Alright, let's go to. Yeah, look down for me, please. Yeah, that's it. Alright, brilliant. Yeah, that's trained. You have wonderful clear eyes, by the way. Very nice to see. You just try to keep your eyes open for me for a second. Yeah, keep your eyelids open. Addison, yeah, does that feel uncomfortable? Okay, sorry. Yeah, no, sorry, it's like, I'm right there. I apologize. eyes if you can. Try to keep your eye open. Yeah, so left first. Okay, and again. Okay, and the right. Keep it open. Thank you. Okay, and again. Yeah, it's fine. I'm just going to hold open your left eye. Just here. Here we go. One more time. One more. Okay. Okay. Beautiful. Thank you. Sorry how close up that was. Yeah. Excuse me. All great. What I will do is just write up a referral because the glaucoma testing is quite difficult, to be honest. The same thing happens to me every time. My eye responds a little too quickly. I blink. And I miss it. Okay? So. It's nothing to worry about. This is a referral for a glaucoma screening. Okay, take that with you, please. And you said did you say you've been having headaches? Okay. Yeah, glasses may very well help, but I'd like you to have a think about the kind of glasses you'd like. Get back to us here, and then we'll sort something. We'll sort the prescription out. Okay. Brilliant. How was that for you? Are you okay? Thank you for being so patient and for being so kind as well. I know it can be frustrating having someone all up in your mug like that, but yeah, it can be a bit weird. But I hope it helped you to relax. And please, yeah, if you've got shades, do wear them because your eyes might feel a little bit extra delicate for the rest of the day. If you don't have any, just ask at reception and they'll give you a pair. It's free, don't worry. Alright, your eyes are great. Don't worry. It's been lovely to see you. And please take care and do look after your eyes. Yeah. Yeah. They exude beauty and they witness it as well. So definitely look after them. Okay. Alright then. Thank you.